Welcome to the very first webinar of Mondosano with the topic What Drives Patients? 10 Pain Points discussed by my dear colleague Anna, who's actually the managing director and founder of Mondosano. And I'm Tim. I'm within the working with the business development department. And Anna is going to introduce Mondosano as a company, and then I will take over and get actually into the pain points of our patients.
Yes, thanks very much, Tim. Let me jump to the next slide real quick. Just so that everyone knows what Mondosano is and what we do. We are a small company, we're quite young, we are based in Hamburg, and we are working for the German-speaking markets. We were founded in 2016, and we have an online platform that is focusing on delivering access to and education about clinical trials, making the markets more transparent and bringing together patients and the industry. The heart of Mondosano, however, is our patient platform, the actual website mondosano.de, where we have information for patients in German regarding clinical trials that they can participate in, regarding new research topics, new therapies, and also different patient communities that they can join, so they have or they can exchange ideas and concerns with their peers. We have around 3,000 daily visitors, and we have a huge database that's constantly growing of registered patients from different TAs. Right now, that's around 80,000 patients registered with Mondosano, and those patients constantly get information from us regarding new trials and then refer them to the nearest site where they can participate in a clinical trial. What I also said is that we have 8 patient communities online where patients can talk to each other and talk about their disease, and where we also place articles, we place information there for our patients regarding their therapeutic areas, so that they can find more information about new therapies. The 8 different patient communities that we have right now are regarding the disease area of asthma, also of COPD. We have one for diabetes, all the gastroenterological diseases as in Crohn's disease and colitis ulcerosa. We have urticaria, we have psoriasis, and also hypertension and Parkinson. And what we did for this webinar is that we asked all these members in these communities, those are around 7,500 members, different questions about their disease, how they cope with their disease, what bothers them in their daily life, so that we could come up with findings that we can present to you today. And I hand over to Tim now to summarize our findings from these patient community talks.
Thank you, Anna. Jumping right into our community survey, as Anna mentioned, we've asked 7,500 patients within our communities, and we received great feedback with way more than 10 pain points we anticipated in the beginning. However, we clustered the pain points we got into 8 clusters or topics we want to discuss today. We received over 1,300 answers within 8 days. And fun fact, the COPD patients were highly responded or gave more answers than any other of our communities. Jumping right into the first pain point mentioned by our patients, which is the feeling of not being taken seriously. On the one hand side, not being taken seriously by the society, but also not being taken seriously by the doctor. Patients feel that people in our society could be more empathetic regarding their disease, we think that this comes from that many people actually cannot understand how it is to live with a chronic disease and how to cope with reactions regarding certain symptoms of their disease. For example, Some patients mentioned having psoriasis and having plaques on their hands or in their face causes certain reactions by society, which they obviously dislike, or they just don't feel accepted. And on the other hand, patients with chronic diseases are more self-empowered and invested in their disease than ever before. Information is readily available in the internet, so patients nowadays come with certain perceptions and a certain knowledge to the doctor. So they're very educated and they exactly know if the doctor actually tells them all the alternative treatments, alternative therapies, and if the doctor actually listens to the patient and the problems they actually have. The next pain point is the contact to other patients. Patients are very keen on sharing information and experiences online. That's why we will build communities. They want a place to chat with other patients about their condition, and this closely relates to the pain point of being taken seriously. Within the closed communities, you have an interaction with peers, with other patients who actually deal with the same problems, and within this space, the patients actually feel alike or feel accepted within the communities. And sometimes it's just talking about what their current day is, or that they have another flare. So they're really keen to interact with other patients. Coming to the next pain point, which is digital alternatives. And patients are more digital than we often might think. Patients actually, they want access to digital solutions. They have recognized that there are several digital therapeutic solutions on the market which can make their life easier, and patients actually want to know which ones have the most value for them. They want to know how the market is developing. Are there maybe new apps coming from Asia, from the US? Basically, new solutions which can help them to cope in everyday life. Coming to the fourth pain point, which is clinical studies. There's still a very, very, very high interest of patients actually participating or who want to participate in clinical trials. Nevertheless, they still don't know how to actually get into a clinical trial. They do not understand what a clinical trial is or what they do in a clinical trial. So it's on us, on platforms like Mondosano, where we actually have to educate the patients, tell them via content what it means to actually participate in a clinical trial, but also to take off the complexity of getting into a clinical trial of the patient onto the industry and make sure we make it as easy as possible for patients to enter a clinical trial. So we pre-screen them and then send them directly to the closest study site if they want to participate in a clinical trial. Next up would be the pain point of the communication or information access of insurance companies. Although a patient is usually very well educated about his or her chronic disease, and they certainly know or have some favors to go to when it comes to information about therapies. However, patients still have trouble accessing information of insurance companies. What is covered, what is reimbursed. They also wish for a broader extent of coverage also. And what we usually get is that the communication with health insurance companies is very challenging, it's very slow. So it would be up for the insurers or for some other industry solution to actually provide a centralized portal where to access information about companies about reimbursement, what is covered, to make it as easy as possible for the patient to access all those information. In Germany, for example, you would have over 100 different insurance companies with different reimbursement or a different extent of coverage, and the patients would have to go to all the different insurance companies to actually access information. The next pain point would be the pain point of time. Patients with a chronic disease spend probably more time at the doctor's office than all other persons out there. So the industry should make sure to make the most of the patient's time. First point, the doctors don't take enough time for me, is closely relating also to the doctors showing them alternative treatments. They have the feeling that it's like assembly line work, that the doctor only has 5 minutes to tell the patient basic information, and then he's getting onto the next patient. The point is, we as an industry, we should think of, is a visit always necessary? Are there maybe digital alternatives to save the patient time? So the chronic illness shouldn't be the time killer #1 of patients. They have problems enough, so we should make sure to find solutions to actually save the patient time he could spend not dealing with his disease. Coming to the next point, which is being limitations. General physical limitations in day-to-day life, but also work-related restrictions due to their illness. We have to keep in mind that living with a chronic illness usually means coping with the symptoms for every day and often for the rest of their lives. So we as an industry, we should work around that or include that and those limitations into our solutions we create. Meaning that in clinical trials, for example, that we work in or work closely with, that could be reducing visits. Now we got the topic of remote clinical trials, but also you could think of how to gather data with Apple Watches. We know that it's being done already, but yeah, this could be progressed more and more and enhanced more and more in clinical trials. Next up, we come to the biggest pain point reported by the community. And although general trust in doctors is still high, patients wish for more transparency when it comes to information access to alternative ways of treatment for the chronic disease. Patients got the feeling that the doctor's not always telling them everything and all the possibilities for therapy. That also closely relates to the point of time, that the patient has the feeling that sometimes when they're at the doctor's office, it's just assembly line work. Additionally, we know patients are more invested, more informed about their disease themselves. So we should make sure to provide the information easily, to educate the patients and give them the possibility to actually educate themselves. So we should provide the information easily available and from multiple channels. The patient shouldn't have to look in multiple channels to actually get the newest insights on treatments or clinical trials, whatever. He should have 1 or 2 access points where he can provide or he can actually access all the informations. Coming to the distribution of answers, the chart shows the relative distribution of the number of answers given per cluster. And here we can see that the most answers were given in 4 clusters, being the information cluster, the limitation cluster, the time cluster, and the insurance cluster, being the biggest pain points of the patients. Yeah, thank you very much for your attention and for listening. Those were the biggest pain points based on the answers from our communities. Feel free to ask additional questions. We're happy to answer them all.
Yeah, are there any questions out there?
If not, feel free to contact us if you have additional questions, feedback, or topics you might want to have covered next time. We plan on doing this on a regular basis, giving more insights about our patients, our patient communities. Yeah, thank you for listening. I hope to see you next time for the next webinar and catch up with you.
Thank you very much.